Hello, everyone. Welcome to another episode of the Women series where we capture developments and stories that impact women. It is still our Mental Health Awareness Month, and today we're looking at a major health concern that affects women's mental health, and that, of course, is the postpartum depression. My heart goes out to every woman who have had to deal with this postpartum depression, and because it is one of those sensitive issues that is mostly not spoken about, we have chosen to shed more light on it and to educate ourselves from the medical standpoint. Now, I have my guest with me who will be helping us with that. He's a consultant family physician at the local central hospital. I'm speaking with Dr. Philip Bamigboye. Hello, doctor. Thank you for joining in. It's great speaking with you. How are you doing today?
Fine, thank you. Good afternoon. It's a pleasure being here.
Yes, the pleasure to have you as well. Yeah, so let's quickly go straight into the conversation for today. Now, we're speaking about postpartum depression. Now, postpartum has been one of the leading causes of mental illness for women. But just to put this into perspective, what is postpartum depression and how common is the postpartum depression?
Yeah, thank you, moderator. Postpartum depression is actually a common entity, but it's actually underdiagnosed because oftentimes some of the symptoms are things that are common and we tend to neglect. And postpartum depression oftentimes says begins even before delivery. It means it can be dated back to the period of antenatal, even actually before the woman actually got pregnant. But actually, if you want to talk about the postpartum depression, you would need some definition to clarify so that you can put it into real perspective. So when we have mood disorder, these are signs and symptoms that affect the mood of a pregnant of a mother who just delivered. Okay, then you can say a woman has a postpartum depression. And this symptoms is significant enough to affect our daily activities, our daily living, the care of the baby, family care, and also to be able to take care of ourselves personally. So when these symptoms become so severe enough to affect our lifestyle, okay, and care of the baby, then can say woman has postpartum depression. But actually, it's actually a spectrum from the mild symptoms, which we call postpartum blues, to the more severe one, which is postpartum depression. So mood disorders, mood symptoms that begin after delivery, okay, that may actually affect the care of the baby or the mother's care or even the family as a whole, okay, then and define that postpartum.
I've always wondered why someone would just put to bed and then she starts feeling helpless, hopeless, feeling sad. I mean, it's supposed to be something of joy, right? But then again, it brings me to my next question. What causes postpartum depression? How would you go from being birthing or carrying a child for 9 months and then
From a
you
happy
deliver?
mother,
Yeah. And then you deliver and then you
become
start.
sad.
Yes, exactly.
Yes, everybody knows the time of delivery is about the time of joy, happiness for the family, especially when if they have been expectant. Okay, but at times some of these things may actually result in sadness and sorrow for the mother. Postpartum depression oftentimes has so many risk factors. I think it's better to put in that perspective, risk factors rather than causes. The risk factors are those things that once we see it in a mother, they give us a clue or they may give us a likely prediction that a woman will actually go down with postpartum depression. Okay, and some of those factors could be classified into 5 different categories just to make it easier for us to understand. One, we have some psychiatric risk factors. Okay, psychiatric risk factors mean a woman who has a previous psychiatric illness or a mental illness, so better could actually come down with postpartum depression after delivery. Probably she suffered depression even before she got married or before she got pregnant. Okay. or she has any, she's been on medications for any mental illness, psychotic disorder, anxiety disorder, and things like that. Those are risk factors. So a previous history of psychiatric illness would actually tilt a mother to suffer from postpartum depression after delivery. There are some other biological factors too that could also explain it can also be a cause or a risk factor for postpartum depression, especially age, okay, extreme maternal ages, okay. For example, those who are less than 18 and those who are above 40, okay, are risk factors. So very young, so the lady who gets pregnant at a very early age, okay, and those who actually got pregnant at a later age, like after 40 years, okay, they have risk factors for postpartum depression. Also, some other hormonal factors also play a role. Okay? You see, when a woman is pregnant, there are some hormones that are released that are present in the woman's body, especially progesterone. At the time of delivery, some of these hormones suddenly drops, and then this could actually affect the mood of the mother. So, hormonal changes after delivery are also been known to be a risk factor for postpartum depression. There are some other socioeconomic issues too, okay, especially from low socioeconomic status, okay, to be a risk factor, feeling that I'm able to take care of my baby, no money to buy infant formula and things like that, okay. So a factor for support from the family or from the husband, okay. The husband is not at home, there is no family support. Okay, so the stress of nurturing the baby, okay, will tell on the mother who just delivered. Okay, then some other risk factors include smoking. The mother who smoke will take alcohol, from chronic medical illnesses, okay, diabetes, hypertension. Okay, those are also risk factors for postpartum depression. And notably also obstetric factors. Obstetric factor is very, very important. Especially the mode of delivery. You see, every mother wants to deliver like a big woman. Okay, they want to enter into labor and deliver by themselves. But at times, labor may not go as predicted. Okay, for the reasons where of their emergencies, probably the mother starts to bleed and things like that. The baby is not coming forth, and they need to deliver probably through cesarean. Okay, so with that, it's not planned. So and some women may feel not fulfilled by not delivering by themselves, so through the vagina. Those could also tilt them into postpartum depression after delivery. So there are so many factors. Some of these factors are intertwined. Okay, we can have one or two or three risk factors in this mother actually tilt them to some of those.
It feels like everything can just be against the woman when she's pregnant, because you just mentioned everything from socioeconomic factors, physical factors, medical factors. It could be anything, right? It could be anything.
Most important is being able to pick some of those things as early as possible before they eat deep into the system and begin to affect the lifestyle of the mother.
Yes. So having established all of these factors, how can it be treated? And most importantly, what happens if it is left untreated and unattended to now on the path of the mother and on the path of the child?
Yes, postpartum depression is best prevented, okay, and managed as early as possible. Okay, prevention is actually better than cure as the common slogan. And usually, what we need to do is at the point a woman registers for antenatal, we need to look out for those risk factors, okay, and address them as soon as possible. A woman who has a previous psychiatric illness, you need to tell them, you need to ask them, how are they faring? Are they still taking their medication? Are they compliant? Are they going for follow-up? Okay, those who are hypertensive, who have high blood pressure, who have diabetes, who body blood pressure, or during antenatal when they come for their booking. There are some of those things we need to pick as early as possible. Okay. Also, for those who have low socioeconomic status, we need to let them, especially for the mother, madam, now that you are pregnant, it's good for you to begin to save money. But one of the issues is not being able to foot their medical bills, especially after. some of is enough to cause depression. You understand? So you tell them, make sure you begin to save money. Now that they are pregnant, in case your labor may not go as planned. I want to deliver normally, but at times emergency may come, you're not able to deliver by yourself. Have enough, save enough money so that when emergencies come, you actually put some of these bills. You understand? Then also make them be expectant that anything can happen. It's not everybody that will deliver by themselves. Okay. So prepare them for emergencies, to prepare their mind that okay, you can also deliver in case you can't deliver through the vagina. Okay. So by the time you prepare the mind, okay, and then discuss with them some of those things, it's easier for them so that the event is coming, okay, and they see by themselves. Yeah, you prepare them and they understand some of those things. So it's easy for them to manage themselves when they go through. Some women will actually deliver and have tear. Okay, they have cuts in the vagina or the perineum after delivery. And it's repaired. Some of these things may cause pain and make them so sad even after delivery. Like what all this? So some of the things we need to let them know. Okay, but these are major risk factors for some of those things. So what we need to do is when a woman after delivery, we need to counsel them on some of those symptoms. And what are those symptoms of postpartum depression? But it's very important for them to know what the symptoms are. But once they need the symptoms, they will know, okay, there's a problem and they will need to seek help as soon as possible. What are those symptoms? Some of those symptoms include excessive crying. You can just see a woman sitting at the baby's side and begin to cry. Okay, if you ask them, Madam, how are you doing? Say, I'm sad. Okay, I'm not happy. I'm even tired of this work. I can't sleep. I can't eat. They poor concentration. At times, when this thing is deep into the system, okay, some people may want to commit suicide or even want to kill the child. Okay, that's how bad postpartum depression can go if it's not picked as early as possible. So before it gets to that point, it's good to address it during the period of antenatal care. When you're able to identify one or two risk factors for this condition. Okay, some of them will say they can't eat. You understand? They feel like this life is just come to an end. Some of the things they like to do, cooking, taking care of themselves, they are unable to do it. They are so unkept and things like that. They can't do, they can't do. So it's a major problem. And with that, they can't take care of themselves, they can't take care of the newborn baby and the entire family. So prevention is the ultimate goal. Pick it as soon as possible and address it. But in situations where patients come in and this is a full-blown postpartum depression, there are medications that can be used. There are counseling sessions that such patients can go through. I advise them to the clinical psychiatrist or to the psychologist, okay, that will help them pull through some of these conditions. They go through some psychology sessions, some training, and some of those things. So it's all encompassing. You also need to involve the family as well, because the family is very, very crucial. Taking care of a mother who just deliver. So involve the family, involve the relation, social support, and so any other things that may be responsible, that you identify that could be responsible for pregnancy.
Yes, I think you answered most of my other questions. I would love to, follow-up questions I would have loved to ask. But let's take this final question. Women who might have found themselves in this situation might seem helpless, just as you said and you've tried to describe. But how can people around them begin to help them to feel better so they can heal faster if they found themselves in this situation?
Yeah, thank you, It's very important for people to know that a time of delivery, okay, it's a very critical period because a woman needs care at that point.
Yeah.
A woman needs bonding, okay, and he needs family support. And good in the in the African setting that we have, family support is very, very critical. It's very, very important. That's why in literature we have the huge rate of postpartum depression among blacks or Africans compared to the whites.
Yeah.
Like the whites, once you deliver, you separate from the family, you are your own and things like that. But in the typical African setting, you have people who come around. Your in-laws come, your father comes, your mother, everybody comes around to take care of the child. So the family plays a major role okay, in managing um, a woman who has
Just put
postpartum depression. I think they can assist with some of the house calls, even if it's how to do with taking care of the baby, bathing the baby, dressing up for the baby, while the mother rests and be able to take care of the baby herself. We cannot but appreciate the fact that the society plays a major role in managing postpartum depression.
Mm. Thank you for shedding light on all of my questions. Thank you very, very much. I think take home for me would be that prevention is very much better than cure. The only way to address this is just to prevent it from the early stage. Thank you, Dr. Philip, for stopping by and having this conversation with me. It was great speaking with you.
All
And
right, thank you.
and that's all we have for you on the Women series for today. If you've got questions and you've got comments, please reach out to me at ayomide.oguntoye@proshare.ng.com. Please follow us on all our social media platforms showing on the screen. And you want to read more of our news stories and follow and watch our videos, log on to www.proshareng.com/webtv. And until next week, thank you for watching. Enjoy the rest of your day.